Tonight, we're taking a closer look at the scope of mental health in Arkansas.
The pandemic has given many of us time to realize we may not be okay and we need help. But what if the mental health assistance we're seeking isn't readily available?
If you're in a crisis, are you likely to get the help you need? THV 11's Frederick Price looks into how the natural state is doing.
The mental health system, it's broken actually in Arkansas.
But Dr. Buster Lackey with NAMI Arkansas says the need for mental health assistance is dire in the state, but that help may not be easy to find for some.
In some of our rural counties, you have to drive back into one of the bigger cities.
Larger cities such as Little Rock, UAMS, the state's largest hospital, created a mental health clinic back in 2020, giving people facing behavioral health challenges a chance at getting help.
Anyone in the state can access care through us with video sessions. It's free.
But Tony Boaz with UAMS says the reality is that even with virtual options available, there are still not enough mental health providers in the state.
I think 72 of the 75 counties in the state are experiencing a shortage.
The demand for mental health professionals is creating longer wait times, an average of about a week if you need aid.
Anxiety and depression there's been such a huge jump in that, and I just don't think the professional schools can get people out quick enough to meet the needs.
The Department of Health has mental health centers spread across Arkansas' 75 counties, but Dr. Lackey says even those services are limited. Now he's noticing a movement among health professionals to add a one-stop shop in clinics.
In primary health care offices, we're putting counselors and mental health providers.
He believes this could help combat the problem of long wait times.
You got a splinter in your finger and you're coming in to get it removed and you're talking to your doctor about depression. Well, now you have a provider that can either see you or get you in pretty quickly.
State organizations continue to address this dire issue. Last year, the Blue and You Foundation granted $5.29 million to at least 6 behavioral health programs in Arkansas. The Centers for Youth and Families got $5 million. Most recently, lawmakers made improvements to the state's suicide prevention hotline.
Our state legislator mandated that the Arkansas Department of Health create and maintain the Arkansas Lifeline Call Center.
One of the problems, Jacob Smith with the Department of Health says the National Suicide Prevention Hotline previously had no connection to Arkansas.
It might be going to, say, Oklahoma or Memphis, maybe Ohio, and they just don't know the resources here in Arkansas.
Since the switch to the 3-digit lifeline 988 back in July, when you dial, you'll now connect to one of the 3 call centers in the state. On the phone, a trained ADH employee who evaluates the severity of the call.
We can see what kind of resource they need, what type of, if it's a lethality type call or if it's just a crisis call.
Another improvement to the Arkansas Lifeline call center, ADH will follow up with another call to see how you're doing after that call. Overall, there's a big shift to enhance the resources of mental health aid in the natural state. Dr. Lackey says that's something that must continue.
Have to build those stronger mental health systems that provides the care, support, and services needed to help people.
Frederick Price, THV 11 News.
Dr. Lackey says moving forward, he'd like to see 24-hour emergency mental health clinics similar to urgent care centers.
And we want to give an additional reminder to Frederick's story here. If you or people you love are struggling right now, at any time, you can dial 988 to get completely free and confidential help. That's the new Suicide Prevention Hotline, and it's available nationwide on every phone provider.